Hello, everyone, in new episode of your favorite podcast, hopefully, Marwa Khalid Podcast. As usual, I feel weird when I say the name of the program when I speak, but it's because I just want you to feel that this podcast is also belong to you and it belongs to Sudan and it could represent anything that could bring us together as one united nation. So today, as we every episode we talk about many subjects related to rebuilding Sudan, from practical solution like talking about business or maybe addressing the media challenges, the rumors, everything. There is other main challenges that we never spoke about in this program, which related to the priorities of how actually people will start rebuilding Sudan, which is the priorities like health, security, and economy. So today we will talk more about the health situation in Sudan. We will address all the challenges that could face. We will talk about it. We cannot address it in this episode, of course, but we will talk about it. We will highlight it. We will speak about the immediate needs that the healthcare in Sudan need. So I'm happy today to have with me for the first time in the studio, and it's weird for me because usually I look at a Zoom like a computer in front of me. So today it's a bit weird to have a guest with me in the studio, and I'm so happy about that. So I'm happy to be. I'm gonna read the title of the guest. So I'm happy to have with me Dr. Ala Altayeb Modather, Director General of International Health. I think I get it right.
Yes, you did.
So I'm so happy to have you with me, Dr. Ala, for the first time in Marwa Khalid Podcast. So hopefully will not be the last. So as we are talking about the health situation in Sudan, and we know that many challenges are facing the health situation in Sudan. We hear people from outside speaking about the health situation in Sudan, podcasters, influencers, but we never heard from official representative from the ministry to tell us exactly what's happening. We know that right now there is an outbreak of some diseases like cholera, dengue fever, and others. So if you can just fill us in of what is the situation right now and how we can, what the health services need right now when it comes to those crises.
Well, thank you very much, Marwa. It's really, I'm honored to be with you today, and I'm very happy to be here physically with you. I tried my best not to just to communicate through like Zoom or anything. I really prefer to
And
have
I
this kind of
appreciate that. I
interaction.
really appreciate
No,
that.
thank you very much. So I'm really honored to be here with you. And thank you very much for shedding light on this very important topic, like speaking about the health situation, the where are we now, where are we heading, where we were before. I think the situation in the country currently is really evolving in a kind of like a kind of very dynamic manner, you know. After the war, Federal Minister of Health has set 5 priorities immediately after the war, and this is
So we're talking right now in
just
the
after April 2023.
Okay.
Immediately, I joined Federal
so
Minister
after
of
the
Health.
beginning of the war.
Yes,
Yes.
exactly.
Mhm.
So this is part of, because every health system to recover, it actually goes through 3 stages. The first one is response, and then we go through early recovery, and then we aim at sustainability and development. So just after the war, Federal Ministry of Health decided to go with 5 priorities. The first priority is to secure life-saving medication and to ensure that all people of Sudan get access to it. Then the second priority was actually providing the basic emergency services, like the basic primary health package.
I
And
think
then
this is urgent.
this
Yeah.
is very important.
Yeah.
Then the third one was actually is to combat and contain outbreaks and epidemics, which is actually was not quite very unique situation after the war, because unfortunately, even before the war, the health system was quite fragile. So after the war and after the deterioration of the infrastructure, we faced a lot of challenges to contain outbreaks. It's not just a health issue, it was a kind of overall infrastructure issue. And it's a wash part, like it's a water, sanitation, and hygiene component that was quite very
Those are
challenging
the
and
main
alarming
cause of what's
indeed.
going on right now.
Indeed. Then the fourth priority was actually to pay special attention to vulnerable population. We are talking about mothers and children and women and those who are living with certain diseases and the vulnerable population, if we can call it this way. And the fifth one, and this is where my directorate falls the responsibility in. It's this is the commanding coordinated response through partners, including UN agencies, traditional donors, and non-traditional donors as well. This is where I fall in this category of the priorities, you know.
I think you need all the support and help because this
Exactly.
is not going to be easy on
Indeed.
Sudan
No, no,
alone.
no.
Yeah,
It's
need
not
to be
no.
collaboration from other.
No, in-country partners will not be able to do it alone. Neither, of course, the external partners, with all respect, but indeed aligning efforts and having like a more of solidarity among internal stakeholders, and as well some support from our bilateral and some multilateral support from outside. This is very important for me. So
Dr. Ala, right now,
yes,
what is the status right now when it comes to
I'm coming.
yeah?
Yes. So the thing is, when we had these priorities, this is called the response phase. We were facing a lot of challenges: shortage in medications, deterioration of infrastructure. As you know, the main infrastructure and the main specialized services were in Khartoum. So, and after the Khartoum was almost devastated by the war, we lost almost more than 70% of the
I think
services,
this is
of the
one of
specialized
the thing
services.
that we need to address in the future,
Thank
that
you
we
very much.
don't
That's one
need
of
to
the
be.
lesson learned that we really
Yeah,
need to work on.
everything in Khartoum,
And
everything
this is,
centered.
yes,
Yeah.
exactly. This is what's called decentralization of health services. And this is one of the lessons learned. You know, even this is when we gather together and discuss like health situation in Sudan. We keep saying that despite these challenges, we learned a lot. We learned that we have to build a more resilient health system that speaks to the current needs and the dynamic needs of the people of Sudan. So, you know, my dear, this is all of it actually is kind of a combination of different factors that had led us to such situation where we are facing this kind of outbreaks: dengue fever, cholera, and malaria as well. Malaria is not kind of new. Even cholera was
We used
like when, you know,
we used to
yes,
malaria. It become
indeed.
like a flu in
Yes, it's a
Sudan.
kind of
Yeah. Yeah,
endemic
pandemic.
in the country. But indeed, there were a lot of efforts. I've read about the efforts and where actually Khartoum was declared free of malaria. That was 20, I think it's 2005, 25. I think 2005, Khartoum was declared
Really?
malaria free. Yes,
Actually,
unfortunately, you can
not many
tell.
people had malaria
Yes,
as something that, but it's just something seasonal. Like some
exactly.
people have it because it's actually because I know some medical stuff. Like I know that sometimes especially the flaccid stay in the blood. If we talk medically, I have a science background, so I know a little bit about when it comes to. So we know that sometimes the malaria stay in the body. So it's not something that could. So that's why that the seasonal thing for many people. But what about the cholera and dengue?
You know, even with malaria and the seasonality of malaria is actually linked somehow to climate change. And I would be very happy if you dedicate a session or a kind
There
of
will be an
podcast.
episode
Oh,
about climate
that's
change.
very important.
And yeah,
Because
the
I
effect of it.
believe this is really linked to the climate change and the seasonality, where we are facing like a very kind of not quite regular rainy seasons. The floods, actually, we used to floods, but with the current infrastructure, with the poor infrastructure we are having now, we were not able to handle the floods quite well. The thing is, Marwa, is that we would like really to make sure that we are investing in the right things efficiently, because the resources are quite limited. The support that we received is not quite up to to cover the gaps, or because the needs and the gap is quite huge. So we really need to build on the existing resources and to efficiently use it. So dengue, malaria, and cholera are all vector-borne diseases. This is the category. They are all transmitted by a vector. A vector means like either mosquito or flies for cholera. So we really need to manage the vectors. And I think it requires a lot of effort, not just from Federal Ministry of Health, not just from its partners. No, it's kind of multi-sectorial efforts, because we have like stakeholders who are quite not very, very linked to the health sector. We're talking about the Ministry of Irrigation, agricultural irrigation scheme, because after
So
all,
it's about connecting and working in harmony with other ministries and other.
that's the word, harmony and synchronization. Because I believe if we have planned carefully to use the resources for what matters the most to end the epidemics, this would be, I think, will bring us closer to our target to end the outbreaks. So dengue actually is transmitted by Aedes. And that's a type of mosquito that actually it's a kind of daily, they have like the daily activity, and the malaria is another one, which is anopheles. It's a kind of night activity. Cholera is actually transmitted through flies, and
Yeah, no, some
this, the kind of lack
sanitation
of hygiene and
wise.
sanitation.
Yes, yes, yes.
So I believe there should be a focus on the preventive measures. And this is actually what Federal Ministry of Health noticed since the beginning. We had our rainy season preparation, and we had campaigns to just do like some of the vector control activities, but it was never enough because the resources are quite limited. And like there is a lot of donor dependency, there was a lot of really need for more harmonization. We have like, for instance, and I'm telling you that we have succeeded to make like rounds and rounds of bed nets distribution. This is like the mosquito bed nets. The mosquito bed nets actually is something used as vector control management tool, but we really need to encourage people to use them. So every single effort
Many people don't
really
people
need.
do not care. They just walk
Exactly.
in the street and they
Yes.
say, okay, whatever happens, happens, and we don't
That's
care.
exactly the
Or
situation.
sleep
And
out without in the bed
exactly,
nets.
or they use it out of its context or mandate. So I think we really need to increase the awareness of people about how important to
And
use
what
these
about the source
preventive
itself,
measures.
like the mosquito itself? We know that there is many ways that we can prevent it. Like,
Thank you very much,
yeah,
Marwa, for raising this question. I think it's very, very, very important.
yeah.
I think maybe you are following up on the official page of Facebook page of the Federal Ministry of Health,
Yes, I'm
where we have
following.
launched a kind of campaign, awareness campaign, and a kind of community campaign. It's called بالتجفيف لازم تجيف.
Oh,
It's
so
like by
yeah,
drying, yes, by drying, we make fever stop. And it's actually targeting dengue fever, because now it's getting like a very alarming
yeah, and I can see that
situation.
people are dying sometimes from
Yes,
it. Yeah, it's
unfortunately.
just
No, the
not.
thing is, the funny part about dengue fever is that the fatality or the percentage of people who dies from the disease is actually very limited, but it has like this kind of dramatic symptoms. We are not seeing this fatigue, like the bleeding, and it's quite very dramatic in its symptoms. But the case fatality rate is not, and this is kind of, I don't want to
It's just
speak jargon, but
maybe just because it's in the media, social media, maybe we are
exactly.
affected by this, because I can hear many people
Exactly.
saying that people are dying from
Exactly.
this
But after
fever.
all, it's quite very, very problematic. And we would like to end it. And very recently, we have been following up with Brazil, actually. Actually, it was endemic in Brazil until now. They have it, but they have some efforts. We would like to replicate
Okay. So
Brazil
are you holding
experience.
any meetings with them too, or some people
Actually,
are?
yes. Actually, the very recently appointed our undersecretary, Dr. Ali Babikir, he was just in Brazil, and he was quite very keen to understand the Brazilian experience, and he's going to as well bring it
I
to
remember I
reality.
had, I guess back in the years, I had the ambassador in Sudan, the Brazilian ambassador. So she talked to me about the way how they do this, because she mentioned that they have some kind of fever, but she didn't tell me the details.
Yeah,
Right
it's a
now I
dengue.
connected.
Yeah.
But the thing is that I remember that they actually develop a way to recycle,
Mm,
how to the system of recycling the waste of the sewage and the waste, as is actually one of the things that help them overcome those challenges when it comes to the health situation or
I agree.
in
And you know what, Marwa? I think this is a high time for us to really being transformative. We should never replicate the very smart point you raised about centralizing health services in Khartoum. I don't think we will repeat this mistake anymore. We would like to see a decentralized system that actually all people in Sudan, they are receiving the same level of quality of services, and this as well is going to be replicated with the all our efforts to ensure that we are combating and containing the outbreaks in the most cost effective and efficient route.
So I want to ask something, last thing in this area of this. We want to know right now what is the immediate needs that you can, through this platform, you can speak to the international community, and what is the immediate needs that could be provided right now to help you combat, or maybe just decrease the numbers of the cases that could happen. What is
Very much. I believe already we shared our needs through the Facebook. It's ready in term of supplies, equipments, and because after all, we use like paracetamol and some adjunct therapy for the dengue fever, and as well. But the most important component and the most expensive, unfortunately, one is the preventive component and the vector control management component.
what is the
Where we
name of
read, because
those?
these are insecticides. We really need insecticides, some bump and sprays, and as well we would like as well to receive support in terms of cars and vehicles, where we really need to do this, and some operational cost, because unfortunately there has been, and I think it's not unfortunately,
And
actually it's a
is
kind of
just
a
this is to
strength
cover
point.
Khartoum,
This
or
is Khartoum, Jazeera, and unfortunately, because disease does not recognize borders, unfortunately now they are disseminating. We have witnessing some cases in
even in
River
dry
Nile and northern state, and this is
northern
quite
states
a new
supposed to be a
trend.
dry area?
Yeah, yeah, yeah. This is a new trend of disease, by the way, given the context now. Actually, the war actually really, really affected a lot the health system. And
And you don't know what to do, and
yes,
from
the
where
thing
to
is,
start.
yes.
Before we go to other, I know you talked about the hospitals and other thing that many, especially in Khartoum, been affected. Hospital, health clinics, all been affected badly when it comes. Can you just give us some just small tour around to tell us what's going on right now? What is when it comes to rebuilding hospitals, and especially in areas like Khartoum, Medani, and also clinic centers, maybe where we people where they can cure cancer, radiations. Probably, if you just give us something in general, you don't have to
No, thank
dive
you very
deeper.
much.
Yeah.
I think this is a very important question, and I think we really need to equip people with some information regarding where are we now and where are we heading to, and what is the gap. Actually, as you recall in the beginning of our discussion, I actually stated something about the stages of the health system recovery, where we are starting with the response, but even with the response actually will continue, but will be overlapped with the early recovery. Rebuilding the hospitals actually is part of our early recovery effort. And we are now developing our health strategy that speaks to this early recovery stage, if we can call it this way. It's going to be 2026, 2028, where we are going to address all the strategic dimension
Like
for
when
this one.
you put a target and time for it,
Yeah,
because it
sure.
give you challenge, and it tells
Exactly.
you that you need to face this challenge or this target by this time. So yeah.
And for your question specifically regarding the hospitals, I just would like to assure you that there is a kind of so many initiatives to rebuild hospitals in Khartoum and in other states as well. There has been within this, one of the very like quick wins of this war and hard won games with this war is that we have reached a kind of decentralized level of the health services. For instance, we have like cardiac center now in Kasala. We are going to have, I think, okay, we have also revitalized the oncology center for tumor and cancer treatment in Jazeera. This is very important, and we are not going to move it back to Khartoum. Nothing will be back to Khartoum. Everything that have been established in one state will remain in the state. And then we will come back to Khartoum, we will rebuild it again. There is a lot of community initiatives. There is a lot of those who are interested. I'm talking about not just Sudanese, even international community are really providing. Maybe it's not like the level that we expected, but at least there is this interest and will to support in rebuilding. We have developed our projects ready, and they are very ready to be just financed. We have prepared a kind of different, it's a kind of list almost under His Excellency's direction. We have, I think it's kind of 40, I believe it's 40 ready drafted projects for just being financing. So whoever is willing or would like to support, just through
And
us.
those for rebuilding, just those
No, for the three stages.
for the three. Okay,
For the
so
three stages. So we are not just planning for now, and not just for the. We are thinking about outbreaks and containment of dengue, malaria, and cholera. But indeed, we are having in mind the early recovery, where we are speaking about revitalizing the hospitals and getting it functional again. And then by the strategic dimension as well, we are looking forward to have maybe a specialized city, specialized medical city in one of the states. We have all of them put down in papers. It's ready to be financed, even it's costed, by the way. So whoever is feeling like ready to finance or support, we are ready to
and
provide all the
I hope
information.
even the one that could be manageable by the government of Sudan, that could be done right now, especially if it could provide recent or urgent help for the Sudanese people, especially the basic health needs like urgent maybe surgeries or help when it comes to radiation and cancer, because we know many people died during those 2 years or almost 3 years because they couldn't have access to those. So I hope that could be something that could find fund and support so we can help all the Sudanese people. So when you talked about the community driven and also the international support, can you just give us examples, especially when it comes to community driven initiative? When it comes, I know many people. I am in a group right now of my neighborhood in Sudan, and right now I can see that many people right now they fund together the hospital near the house. They fixed it, they provide all the help. Even they find doctors to actually work. It's a completely community-driven initiative to
I am
support and help.
impressed. I
Yeah.
am speechless when it comes to the community resilience. Sudanese has shown that they are not easily like broken. They have stated that we are here and we will get our country back. And for that, I admire myself and you and every
We are
single
proud Sudanese,
Sudanese.
yes.
Yes. So the thing is, these kind of things were quite very, very inspiring. I can tell you from now to I can just start talking and never stop about how amazing community has been during this war and during this. For instance, let's start just after the war, when Khartoum people were displaced outside. The funny part is that we never witnessed a kind of IDPs camps for internally displaced people. We haven't seen like camps or tents or anything.
Yeah,
They went
it's
to
a
their
brand new
extended
experience. Yes.
families
Hmm.
and they stayed there, they worked and they lived and they were very fine with it. So this kind of community resilience, this is social cohesion that we really need to strengthen and build on. There is this emergency rooms. Those guys, those brilliant young people we are really proud of them. They were working very hard in very difficult situation to support people of their neighborhoods or even the next neighbor, or this generosity was quite very contagious. Everyone was quite too generous. They were sacrificing everything just to stay and serve people in need, elderly people, or whoever is desperate for help. And the most important component is that, and I'm really proud to be a kind of one of them, is the Sudanese health workforce. Sudanese health workforce and Sudanese health workers, I'm talking about doctors, nurses, public health officers, medical assistants, those who are in very
Even the
distant
guard of the
rural areas.
hospitals.
No,
Come on,
everyone,
everyone.
even the guards actually, they protected the assets of the hospital from looting, because they said that we would like to get some of these assets. They took it aside, and when the state were liberated, they brought the assets back. Can you imagine? So, and I think this is another dimension of how we see ourselves in this manner. But the most important component that we really not to forget is the Sudanese diaspora, Sudanese outside the country. Yeah, I can't even tell you how wonderful they were, how very generous and very supporting and very understanding. Actually, they were financially supporting their families. The families, actually, they lost everything. We are witnessing a severe demographic change in the country, where the social status, the socio-economic status of people have like downgraded significantly, and now they are dependent on the people outside. So Sudanese outside, they showed a remarkable pattern of solidarity with their families, their neighbors, and other as well. When we had like we needed some support with the renal dialysis for kidney patients, they were there. They were saying, okay, just tell us what to do and we will send you. They sent it, they support, and they were there to support Federal Ministry of Health efforts and everyone's effort. And this is only the recorded part. I am dead sure that there is a lot of stories that will come after the war ends, inshallah, and we will see Darfur areas and Kordofan free. We will see and get liberated, and inshallah, Sudan will still be in peace. We will, inshallah, listen to more
This
stories.
is
I
actually getting
promise.
me emotional. Yeah, I hopeful because I lived in the war for 3 months. So I stayed in an area where I was inside the conflict and I was in Khartoum. So my dad is actually doing dialysis. So we had to take him to dialysis every time. And I'm telling you something. The people who were the doctor, the nurses, they were living inside the hospital to actually, they didn't know anything about their families and anything. They didn't return to their houses since the start of the war for 3 months. They didn't have a phone call, or they just waited for all the people who want to do dialysis to come to do the dialysis. Can you imagine? This is just one example because we're running out of time. So I just want to tell them thank you, and for all the people who are still doing this until
We
now.
call them the
Yeah.
White Army.
Yeah.
Jaish
Al
al-Abyad.
Jaish Al
Thank you
Abyad,
very
yes,
much.
and
Yeah,
Arabic.
thank you very
Thank you so
much.
much. Thank you for you too. So the last question, because I think we have about 5 minutes or something like that. So when it comes to Al Fasher, now there is a siege that been surrounding the Fasher for almost 2 years right now. There is a health crisis. There is a food crisis. There is many things going on right now in Al Fasher. So if you can address right now the health situation in Al Fasher, so the whole world can understand what's going on right now. So please.
No, the thing is, I really feel very sorry about what's happening in Al Fasher.
Mm-hmm.
And I even feel really frustrated with the silence of the world and the international community and the human rights organization. Um, what's happening in Al Fasher is something that's quite very very unacceptable in terms of all international laws and regulations. People are dying, people are suffering, but things will, inshallah, um, hopefully, be settled soon. For us at Federal Ministry of Health, we never considered Darfur or any district or states that's under the militia control beyond our control. We've been serving all people of Sudan, no matter which and no matter under which area of control they fall.
Mm-hmm.
People of Darfur are ours. They are our people.
Yeah, our
Yeah, and we
brothers
will
and
never forget
sisters.
them.
Yeah,
So they were
they are part of
efforts. Yes,
Sudan.
they are, and they will continue be part of Sudan. So what's happening now, Marwa, is that we have arranged several airdrops. We have airdrops,
Yes,
the
yeah, by
commodities,
planes
you
when
know,
they get,
yes,
yeah.
the commodities and the medicines, and even we have been able to deliver some vaccines. The vaccines for children actually is kind of one of the priority area. You remember priority area 4, where we're talking about mothers and children. Immunization is a vital service. And I think this is an area that I have to salute everyone who's working in the mother and child health program, primary health care in my country, vaccinators who are really doing great job to reach the outreach.
And also
So
to thank the doctors right now in Al
indeed,
Fasher.
they
Now
are, they are
they
doing
are in the,
amazing job. I'm
yeah.
coming to it. So the thing is, despite these challenges, I'm telling you, we are following up with the people there. How are you doing? How are you getting treatment? How are you doing this? And follow up after the airdrop and everything. I say, do you? No, people are there. They are still having the hope. And can you imagine when we have this Zoom meeting with them or anything? They keep smiling. You know, I feel very small. I feel very small when I see them smiling despite these challenges and hardship they are undergoing. So from here, I would like to send them a word of respect and a word of thanks and gratitude for the great job every health workforce are doing in all that 4 areas. And we are not to forget them. We are not to leave them behind. They are ours, and the people of Darfur are ours, and we will continue to serve them, inshallah.
Inshallah. Thank you so much for those amazing words that you said. And I don't think I can say anything after that. So I'm just going to say thank you so much for being here today with me in this special episode. And I know when we want to speak about the health situation in Sudan, it will not, 30 minutes or 40 minutes will not be enough to describe on. And I can see that you're getting emotional when you're speaking right now. And I know that the situation is a bit hard because I lived it myself, and I know how hard it is when it comes to address all of this. But we hope that everyone is listening right now to us, inside Sudan, outside Sudan, to help with whatever we. Yes, we're gonna stand on our own eventually, today or tomorrow or after tomorrow. We are resilient people. We are able to survive even without help. But we want the help right now, and we want the support of all the people who can just provide any kind of from medicine, from all we mentioned before, to support and to address and to help in combating all diseases right now in Sudan, and also help rebuilding hospitals. So thank you
You're
again.
welcome, Marwa.
If you want to
Thank you.
say for final
No,
things.
just thank you very much, Marwa. And I really count on you and all the positive media to reflect on the current situation on the country right now. And we are really together on this. I don't feel like
Yeah, it's
alone.
a
We are just,
teamwork.
yes, it's a
It's a
teamwork,
teamwork.
all
Yeah.
of us. And making the maximum use of this platform. I would like just to encourage everyone, if they have any support that they would like to address to their people in Sudan, we are very open. And I will be sharing my email.
Yes,
Yes,
please.
I'll be
I will
sharing my
make
email.
sure to provide
Please,
it.
I will be
Yes.
sharing my email, and we are ready to respond 24/7 as much as possible. And we are really grateful for this opportunity. Thank you, Marwa. I wish you all the best.
Thank you
Thank you, my
too.
dear.
Thank you too. And thank you. And have a safe journey back to Sudan. And please
Thank
say
you, my
hi to
dear.
Sudan, because right
Inshallah.
now I cannot go back. I hope I can go back soon, inshallah.
Inshallah.
So thank you so much. And thank you to all the people who are watching us right now. And I hope this episode is informative to you. You understand more about what is going on in Sudan. And wait for me for another episode from Marwa Khalid Podcast. And goodbye.